Welcome to Public Health Ideas. My name is Sandro Galea. I serve as Dean of the School of Public Health at Washington University in St. Louis. These are conversations that are intended to highlight work that advances the science of health. Today, I have the privilege of speaking with Professor Doug Luke. Dr. Luke is a distinguished professor in public health at the Washington University School of Public Health. Today, we're going to be discussing his paper in the Annual Reviews of Public Health, Bridges and Mechanisms, Integrating System Science Thinking into Implementation Research. Doug, thanks for joining.
Thank you, Sandro.
So let's talk about this paper. Tell us a little bit. This is a review paper that is a culmination of a lot of your work. Tell us a little bit about your work that led up to this paper.
Well, I'm old enough now that I have to go back pretty far. In fact, really back to grad school. I had taken a class on network analysis, social network analysis, and I thought it was like the best thing ever. But I didn't know if I would ever use it because it just seemed so out there. And I was like, why am I so interested in this method of looking at the connections between people? And it was a few years later that I came across a paper, and I'm going to risk bringing this conversation to a screeching halt. I'm going to read a quote.
Please, go ahead.
This is from Alan Barton, and he wrote this in 1968. He's a sociologist. And he said, for the last 30 years, empirical social research has been dominated by the sample survey. But, as usually practiced, using random sampling of individuals, the survey is a sociological meat grinder, tearing the individual from their social context and guaranteeing that nobody in the study interacts with anyone else in it. It is a little like a biologist putting his experimental animals through a hamburger machine and then looking at every 100th cell through a microscope. Anatomy and physiology get lost, structure and function disappear, and one is left with cell biology. If our aim is to understand people's behavior rather than simply to record it, we want to know about primary groups, neighborhoods, organizations, social circles, communities, etc. And when I read this, it was like a bolt. I was like, that's why I'm interested in network analysis. I was a methodologist looking for a reason to exist, really. And so the ideas for this recent paper really started way back then.
That's a great quote. I didn't know that. It's actually quite jarring as a quote.
Yes.
Tell us a little bit about system science principles. So how do they broadly inform implementation science? And what's perhaps this is another conversation stopper. Tell us about the philosophical framework that supports this integration.
So implementation science, it's a relatively new discipline. I've learned a lot about it since joining WashU faculty a number of years ago. But implementation science is about moving scientific discovery into the real world, into neighborhoods, into healthcare systems. A lot of my policy work is in tobacco control. And we've known for decades the best way to keep kids from starting to smoke. You make the products expensive, you pass comprehensive clean indoor air laws and the like. So the science has been around for a long time. But why is it that Missouri has a pretty high smoking rate compared to states like New York or California? It's the same science. What there is a gap, there's an implementation gap. That is, other places have implemented better and more effective policies, and places like Missouri hasn't. Why is that? Well, that's what implementation is trying to study and understand and then accelerate, is how do we get more of the best science into communities where it will really benefit everybody. So that's where we start with implementation science. In terms of a framework, I would say that one way we can think about this is, at the risk of oversimplifying, in the social sciences, there's two grand traditions to thinking about causal inference. One tradition emphasizes internal validity. We try to control everything and focus on a narrow question, often is, does this intervention work or not? And that leads to things like randomized controlled trials. The other tradition is one of external validity, where we're trying to understand something and really always ask ourselves, is this what's really happening in the world? And can we influence it? So it takes a much broader view of how we study causation. System science is a set of, well, it's a meta-science, really. It's also a set of methods that recognizes that the world is a messy place. It's made up of complex systems. Complex systems are aggregates of individual entities. They're very heterogeneous. People, but not just people, businesses, laws, neighborhoods, policies, culture, all of that forms a complex system. All those pieces interact with each other, and the system itself has behavior. And that behavior is what we call emergent behavior, because you can't predict that behavior by looking at the individual elements of that system. And where that connects with implementation science is that when we are implementing a new practice, a new policy, it is entering some complex system, whether it's a hospital system, whether it's a neighborhood, whether it's a state.
So that was a great summary. So I liked a lot about this paper, but there was one part in particular which I liked, which is sort of trying to move beyond this implementation science metaphor of the pipeline, which is implementation science is a pipeline metaphor, right? Science moves in a linear fashion. You go from ideas to having practical effect. But in your paper, you actually draw on the work of Haw and colleagues that suggests unpacking the pipeline model to view interventions, and I quote, as disruptive events within dynamic evolving systems. So talk a little bit about this, and talk a little bit about how this perspective can change implementation approaches.
This was a more proximal cause of this paper. When I read Penny Haw's paper, she's in Australia, I think recently retired, and she basically said we have to stop thinking of interventions as packages that we are crafting. She didn't say it exactly this way, but I viewed it as this sort of biomedical approach that an intervention, we create it like a pill. We want it to be inexpensive. We want it to be effective. We want it to be palatable. That is, we spend a lot of time focusing on designing the intervention. Penny said, okay, but when an intervention happens, as I said just before, it enters an existing system, a place that's inhabited by people who are behaving, essentially she was saying, you got to think about the context of the intervention. When we have a new policy in place, it disrupts things. It changes power dynamics. It brings new people into the system. Maybe it gets rid of some people. We have to understand how people find out about the new practice or policy. So we have to think about how is information diffused in the system when a new intervention comes in. I mean, she really flipped the script, which says, if we really want to do a better job of interventions, spend less time studying the intervention itself and more time studying everything around the intervention.
Tell me a little bit about the mechanisms framework. So how can a mechanisms framework integrate implementation science and system science?
Okay, it's partly based on what I was just saying, but it's also based on another challenge we have in the social sciences, and particularly I would say epidemiology and public health. So much of our work is associational in nature, whether it's observational data or using large-scale surveillance systems, risk factor studies, observational studies. We end up studying, collecting data that we divvy up in these variables, and we end up with sometimes simple, sometimes very complicated regression models, for an example. And unless it is really coming out of a pure RCT, most of what we're looking at when we look at these results are correlations or associations. And the issue is, if we have a relationship, let's say, between food environment and downstream health outcomes, we have to understand, well, how does that food environment actually work to shape those health outcomes? It's not just a correlation. Correlation's 0.6. So what? What does that mean? Instead, we have to say, what are the levers and gears? How does that environment shape behavior or change access to resources, or how is information delivered in a way where we can follow the path from the environment to people to behavior back up to groups and populations? Oh, and sorry.
Yeah, go ahead.
The mechanism approach is fundamentally a very different way of thinking about how to collect and analyze data. It's much more like engineering, I would say, where you actually think something is going on out there, and our job as scientists is to identify what that thing is, what those gears are, what those levers are.
shifting gears slightly, tell us a little about the implications of system science approach to equity and ethics in implementation science.
It's a great question, but also a tough question. And I think I have two thoughts. One is, this is more tied very directly with system science first. Health disparities, inequities, racism, oppression, these are things, they don't happen accidentally. And they don't happen because people are born racist or individuals act in a racist manner. These things come out of systems. In fact, that's why we sometimes call it systemic racism. And these are things that are produced by how we as a society act. By redlining was an actual policy that resulted in segregation that lasts for decades, if not hundreds of years, after the policy itself is gone. And so system science allows us, again, to unpack what are these gears and levers that actually produce these inequities in the first place. And for me, it's very empowering because it gets us beyond just the value statement. I want to work, to reduce or eliminate disparities. Well, how do you do that? Well, you do that by seeing how they're produced in the first place. So that's the first response. The second thing, which is more tied directly to implementation science, is, remember what I said earlier, implementation science is about getting scientific discoveries into the world where it matters. That begs the question, who benefits? Who gets access to those discoveries? And if you look in any area of medicine, clinical science, public health, there are groups who either never get these benefits or they're the last one in line. And so I think, again, thinking in network terms, which is a lot of what we do, when a discovery gets thrown out there, disseminated, diffused, we can map and see who are the groups that are first at the table and who are the groups that are last at the table. And so in that way, system science and implementation science really have strong equity consequences. Yeah.
My last question. So how does connecting system science to implementation science improve our engagement with thinking about social determinants of health and advancing implementation research?
Well, I just came over here from another part of campus teaching the theory seminar for our doctoral students. And today's topic happened to be social epi and the theoretical orientations. And you won't be surprised, we talked about fundamental cause theory. Or as one of our authors, one of the epidemiologists called it, the causes of causes. And this is, I'm preaching to the choir here, but this is a focus on moving away from the proximal causes of health outcomes. And the further back we move in the causal chain, we find that there are fundamental ways that our society is structured that have implications for who has access to resources. And instead of thinking about an intervention for this kind of cancer or this kind of diabetes, it turns out that these gradients of access to resources influences a wide range of health outcomes. An example in my own work in tobacco control, we know smoking causes lung cancer. And so you can intervene by making cigarettes more expensive. But you can also start asking yourself, well, why is it that it seems like certain groups of people, historically with tobacco, women, people of color, LGBTQ groups, they were targeted by the tobacco industry. And it's been harder to intervene by just raising prices sometimes. So this is an example of if you move back and back and back, and you're always asking yourself, well, why is it, for example, that certain groups smoke cigarettes at a much higher rate? We can make it more expensive, but we can also understand how the industry has targeted these groups, and that helps us understand other ways of intervening.
Thank you for writing this paper. Thank you for the work you did.
Okay.
Thank you, Doug.
Thanks.